I'm joined by Magdalena Kirchner, and she's going to be telling us about her approach to hormone replacement for women in particular. Welcome back to the show.
Well, thanks for having me again, Amy.
Absolutely. So this is a really hot topic, hormone replacement. Tell me a little bit about what it is and what kind of problem solutions it helps people with.
So I think what we're going to talk about today, like my book, Get Your Mojo Back, we're going to talk about women today, hormone replacement for women. So typically women come in when they're over 50, because average age of menopause is 54 years old. And women complain of not being able to sleep, of having hot flashes, night sweats, and fatigue. Gaining weight, of course, is a big problem, out of control weight. So they come in with these complaints, and we ask them a question: when was your last menstrual period? If it was more than 6 months ago, typically that says you're in menopause. Okay. Also, we have some laboratory tests that we can confirm menopause. And then we talk about possibility of hormone replacement if she's a candidate.
Okay, so a lot of those things you said, 50, gaining weight, and some of the night sweats and fatigue. And then how does hormone replacement therapy work, and how do you work with clients with that?
So the hormones that I like to administer are called bioidentical hormones, which they are exactly the same as our natural hormones in our bodies, Amy. So we have estrogen, progesterone, and testosterone normally as women. So these are identical hormones to like we have in our bodies. So they bind to the receptors in exactly the same way. So basically allow us to feel like we're 30 years old again.
Nice.
Yes, so we are sleeping, we have energy, we feel like curling our hair again. We feel like dressing up.
We got our mojo back.
Yeah, we got our
mojo.
Exactly right. Exactly. We feel like running a business, or we feel like doing Cincinnati Refined.
Yeah.
All that stuff that kind of, we lose that mojo with loss of hormones. That maybe the joie de vivre is another way to say that people experience.
So what about side effects, and how has it kind of refined over the years? How has it gotten better?
So the big risk of breast cancer is breast cancer scares. Of course, that more applies to synthetic hormones, which were the ones made out of horses' urine out there, Premarin, Prempro, all these kind of hormones that women were taking. With bioidentical hormones, the risk is a lot less. Almost negative. Recent studies are coming out. They're saying that it actually lowers the risk of breast cancer by identical hormones. So, of course, in women that have had breast cancer, you can do hormones, but probably best to see a specialist or talk to your oncologist first before you would proceed with that.
Yeah. So the first step is to give your office a call. You get labs done to confirm things and kind of go from there and see what is a best fit for someone?
Yes. If you're a woman over 50 or even after 45, because some of us start earlier, and you can't sleep, you have nights with hot flashes, you're very fatigued, you feel like your life just has changed and you can't put your finger on it, yes, please give us a call and make an appointment for a consultation, and we'll go on from there.
That's great. Well, thank you for sharing that. And I know we've talked specifically about women here today, but it also can benefit men. And in a future episode, we'll be talking about that and be able to talk about the benefits in particular to men, right?
Exactly. So all the excitement to come. We're going to talk about men and hormone replacement for men in our next episode. Men benefit as well.
Yeah, men
couples benefit as well.
Ooh, I like
because
that.
Another side effects of low hormones is loss of libido.
Ooh, what a cliffhanger. We're going to be talking about all of that and more. Well, thank you for sharing a little bit about that here today. And to learn more about Victory Wellness and Med Spa and hormone replacement, log on to their website, victorywellness.com.